Guys, welcome back. Today we'll be talking about several different lung volumes. Looks like we're going to cover 8 different values here. We'll try to give you some really basic and easy to understand definitions, so hopefully that can help you in your studies. So start off here, we'll start with tidal volume. This one pretty basic but very important to understand because you'll kind of need to understand this to in order to understand some of these other values down the line. So what tidal volume is tidal volume is going to be the amount of air in and out of your lungs during a normal breath. So air in and out during a normal breath. So pretty basic, but like I said, critical to understand this one moving forward. A normal value for tidal volume is going to be about 500 mLs per breath, or if it's a weight base, it could be about 6 to 8 mLs per kilo of ideal body weight. So that's tidal volume there, very important moving forward. Here for vital capacity, this one's similar to tidal volume, except now with vital capacity, this is going to be the amount of air in and out of the lungs following maximum inspiration and maximum expiration. So this is air in and out, so that's similar to tidal volume. In and out of lungs following maximal inspiration plus expiration. Okay, so maximum breath in, maximum breath out, that's going to be your vital capacity. Third here, we have residual volume. So residual volume, this is going to be the amount of air that is left over following maximum inspiration and expiration. So technically following your vital capacity, right? So this is air left after, let's put air remaining. That's a better definition. Air that's still remaining in the lung following maximal inspiration plus expiration. So max inhale, max exhale, and the amount of the volume of air remaining in your lung following that is going to be residual volume. Now, for functional residual volume, this one's very similar. So this one is going to be the amount of air remaining in the lungs following a normal breath. So how I remember that is, functional residual capacity. I just think of, I'm functioning normally, just normal function. That's kind of how my little memory trick for that. So this is air remaining in the lung following a normal breath. And remember, what did we say the normal breath is? That was our first one. That's our tidal volume, right? Okay, moving on here to number 5, your expiratory reserve volume. So your expiratory reserve volume, this is going to be the additional amount of air that you can forcefully exhale after a normal exhalation. So normal breath, breathe in, you exhale, and then if you were to forcefully exhale whatever you can get out after the normal breath, that's going to be your expiratory reserve volume. So this is going to be additional air that can be forcefully exhaled following normal exhalation. Okay, and then inspiratory reserve volume number 6 here, it's going to be the exact same thing, except now we're talking about inspiratory, right? So this is going to be the additional air that can be forcefully inhaled following a normal inspiration, so a normal breath in. So you can't see me if you just breathe in, and that extra breath you can take in there at the end, that is your inspiratory reserve volume. So this is going to be additional air that can be forcefully inhaled following normal inhalation. All right, 2 more here we'll talk about. Okay, so total lung capacity. So this is your sum of all lung values. So what this is total lung capacity. Basically, how I like to think about it is it's going to be vital capacity. So when we talk about vital capacity, is the air in and out of your lungs, followed with maximum inhalation and exhalation. But this one's also going to include residual volumes. So this is air in and out of the lungs following maximal inhalation and exhalation plus remaining air in the lungs. So what you can think about this is really, so we talked about air in and out of the lungs following max inhale. So what is that? That is going to be your vital capacity, and then air remaining in the lungs, this is your residuals. So max in, max out, plus everything left over. That's going to be your total lung capacity. Okay, lastly here we'll do number 8. Number 8 is going to be minute ventilation. So with minute ventilation, this is the amount of air in and out per minute. So how you can measure this, the formula, if we know that this is taking normal breath. So a normal breath, we said, is our tidal volume. So what this is, actually let's write the definitions first. This is air in and out per minute, obviously minute ventilation, just during normal breaths, right? So during normal breaths. All right, so how you measure this is if you know, okay, you say, okay, so what is air in and out during normal breath? That's our tidal volume, right? So we do tidal volume, and then per minute, so now that's just, how do we measure breaths per minute? That's our respiratory rate. So if you do tidal volume times breath per minute, then you can get your minute ventilation. One thing to keep in mind here is that our tidal volume is typically measured in mLs, and then obviously respiratory rate is going to be breaths per minute. But your minute ventilation, a typical value here is actually going to be about 5 to 8. This one's going to be measured in liters, so liters per minute. So just know if you ever have to calculate, they were to give you tidal volume and respiratory rate, just pay attention here that you'd have to flip and make sure your units are the same. So get it to liters. Okay, those are the 8 values we discussed today. Do a quick scroll up here so I can see it again. So we had tidal volume, such as normal air and in and out during normal breath. Your vital capacity is similar, but this is going to be maximal effort. Residual volumes, that's which is remaining in your lungs. That's following maximum inhale and exhale. Once again, functional residual capacity. Remember, like I'm just functioning normally. So that's just air remaining in the in the lung following a normal breath. Then we have our expiratory and inspiratory reserve volume. So that's just the additional air we can either breathe in or breathe out following a normal breath. Our total lung capacity, that's the sum of all lung values. So that would be your ERV, IRV, vital capacity, residuals, everything. So all air in and out of the lungs plus everything left over. That's total lung capacity. And last, we talk about minute ventilation. So just air in and out per minute, and that's with normal breaths. And obviously we talked about the formula here to calculate that. So hopefully y'all learned something. If you liked the video, please like and subscribe to the channel. Trying to continue to get this thing to grow. We're making a little progress here, so I appreciate it. If any topics y'all want me to cover, please let me know in the comments, and I'll be happy to get a new video out. Thank y'all.